Harriet Chalimpa, a tailor in downtown Kampala, is among many Ugandans who find it hard to afford health care.
Nangamba oyina abaana ne mugamba dokita nina abaana. Nangamba twasanzeemu oyinamu kansa. Nanga naye engeri gye twasooka okubulabula tetugenda kukoma ku ekyo baawa ayina ssente oba ekika kyammwe balina ssente ne mugamba omwami yasobola buli mwezi lyemira ngula empeke za mitwalo 1968 buli mwezi.
Uganda and South Sudan are the only countries in the East African region without national health insurance schemes to relieve their citizens of the burden of paying medical bills using cash. 11 years ago, a health insurance bill was drafted, but it is yet to be tabled in Parliament.
There was also the issue we spoke about last year of the national health insurance. I don't know when it will come. I don't know how many of your countries have it.
Sources tell NTV that the resistance to the bill was caused by government fearing to ask investors to contribute to medical insurance for their employees.
There's nothing stopping the ministry from having a bill. I think what we can report is that we have progress. As you are aware, we received a certificate of financial implications.
Government per capita expenditure on its citizens has dropped from $65 15 years ago to $10 today, and because of this, the national insurance scheme would come in handy.
It is important to clarify that when they say access health services which they need, it doesn't mean that Uganda should provide today liver transplants, hand transplants to every Ugandan who needs them. It doesn't mean that. It means that Uganda, with the resources which we have today, should be able to provide a certain level of health services.
There are four components of the minimum health care package. The first one is about health promotion, education, and disease prevention. Then the second one is on maternal and child health.
In the proposed bill, 4% will be deducted from Ugandans in the formal sector, while the employers will pay an additional 4%. Those in the informal sector, totaling about 15 million people, will pay 100,000 shillings annually. From the informal sector alone, government could reap 1.5 trillion shillings annually. The bone of contention in the delay in tabling the bill comes from who will manage the fund.
Quality health care is a human right, and Uganda needs a national health insurance scheme to ensure that its citizens can receive health care without having to suffer the burden of financial difficulties. But until such a scheme is in place, Ugandans such as Harriet Chalimpa will continue to suffer the burden of expensive health care. Gillian Nantume, NTV Tonight.